I think when I look at the opportunities to fix some of the key policy issues, now there are challenges with this administration, of course. We need to make it clear vaccines are an absolutely critical public health tool and one of the most impactful medicines and technologies we've ever created as an industry. I actually spent 12 years of my career only working on vaccines, so I'm a big believer in the power of vaccines. We need to also fight for the power of good information. But overall, I see the opportunity to fix three big policy issues we have in the U.S. One is the IRA, which was hugely damaging to small molecule drug innovation. The second is the PBM middleman issue that we have in the U.S. Most companies in the U.S., including Novartis, pay 50% or more of their gross sales to the middleman. And the question is, how can we fix that system? And the third is the drug pricing around a program called 340B, which has become a huge issue in the U.S. If we can fix those three policy issues, manage some of the challenges that clearly the new administration also brings, and then leverage the fact the whole movement is towards non-communicable diseases, which is certainly a sweet spot for a company like Novartis, I think we can thread the needle and really make this a positive thing for the Novartis and for the industry.
So, Vas, I take everything you say on board in terms of the positives. I want to spend a little bit of time on the negatives, though. Immigration all over the world is hugely important to you. In the U.S., where you have your biggest footprint, also here in Switzerland. The U.S. immigration reforms and the plans, executive orders by the new administration, what does that do to the talent you can acquire?
Well, I think one of the most important things we need to protect is in being able, as you know, to get talented people around the world to be freely moving. Of course, there's a whole set of other immigration policies that are getting rolled out which don't have an impact on Novartis. But most important for us in Switzerland, in the United States, and other places that we operate, we need to get the most talented people in the world to the right places where we operate. So far, that's not been an issue. I mean, we've always been able to navigate that despite kind of the anti-immigration rhetoric that you hear around the world. But that's something that's really key for us, and we always highlight that to policymakers. We're in the talent business in the end. The only way we discover the next breakthroughs is having great people.
One of the things that you singled out during the interview in Davos last week was a potentially more permissive FTC. You've really been leading the efforts in terms of smaller scale M&A when it comes to the biotechnology sector. Will you continue that leading role now that the FTC might become more permissive? And what are you looking at exactly?
Yeah, we're really excited about what we've been able to do the last 18 months. We've done around 30 deals, mostly in the small space, as you recommend, but that's enabled us to bring a whole set of new technologies into the company, which we're excited about filling up our early and mid-stage pipeline. Yes, we want to continue that track record of accessing external innovation. Usually for Novartis, about 60% of our sales is from internally created medicines, 40% is external. I'm comfortable if that goes to 50-50. We need the best medicines we can find in each one of our key therapeutic areas. Focus areas for us are continue to be oncology, cardiovascular disease, immunology, neuroscience, and these next-generation technology platforms where Novartis has created a leadership position, radioligand therapies, cell and gene therapies, and RNA therapeutics. And deals that we find in these spaces that fit our strategy, we're going to go after aggressively and try to bring into the company.
Why not a bigger, more transformative deal? It seems like you've got enough cash on your hands. You're also promising a higher dividend. Why not that big deal?
When you look at the history of our sector, large deals have not usually paid off. I mean, in most cases, they significantly disrupt drug R&D, the synergies don't materialize, and in general, when you look at the long history now over 20 years, generally big deals have not paid off in the biopharmaceutical sector. Bolt-ons do, though, if you can integrate them well and bring those technologies into the company. And when you look at the strong free cash flow, we had $16 billion. I mean, I'd love to point out as well, we've spun out Sandoz, spun out Alcon, exited consumer health. Our free cash flow is actually higher, our valuation is higher, and our growth rates are higher. So we really proved the strategy is working. That free cash flow allows us to pay a strong growing dividend, continue to look at bolt-on M&A, and do share buybacks as appropriate. So we can do all three, and I think that's a very unique position that we have.
Can I ask you, given that you've really been working through this turnaround, this transformation of the business, you've really been focusing on some of the key areas here, when I look at the share price, I get the sense, yes, it's improved, but are investors giving you the credit that you think should be due?
I think every CEO feels like there's not enough credit given to all the performance and work that you do. Look, I think in the long run, the share price will eventually come. I mean, right now we're dealing with a lot of macro issues. There's the entire shift into, probably overshift into AI and these technology companies, which led to a disinvestment in the pharmaceutical and healthcare stocks. I think also you're dealing with all the uncertainty of the new administration. But in the long run, when you look at the fundamentals of our business, how we've been able to grow sales, core operating income, free cash flow, strong innovation pipeline performance, I think that will continue to pay off in the long run. And when I look at TSR, we're in the top 5 in the 1, 2, and 3 year period. And if we can keep that going, that will be what really matters.
And AI could potentially transform your industry as well, right?
I mean, AI will have a big impact, certainly, on drug discovery and drug development. I do worry sometimes it's overstated. I mean, this is really hard. I mean, when you think about what we understand about how the human body and how it operates, we only understand a fraction of what's really going on inside the body. Some would say only 4 or 5%. So AI can only leverage from what we know. And so certainly it could speed up drug discovery, make us a little faster, hopefully get our probability of success up. But let's remember, in general, we're a 10 out of 1,000 projects that we take in research ultimately gets through to registration. If we could get that to 20, that would be amazing, but it's still 20 out of 1,000. And so I think we have to keep AI in perspective. Hugely transformative, but will take time to deliver results.
All right.